Hello, my name is Narelle Smith from Public Health Services. Welcome to our community information session today about the Healthy Tasmania Fund, Round 2. I would like to acknowledge the Tasmanian Aboriginal people as the traditional and original custodians of the land on which we meet today, Lutruwita, Tasmania, and pay my respects to Aboriginal elders past, present and emerging. I'd also like to acknowledge that Aboriginal people have long recognised a holistic view of health and the important connection between culture and country and community, and the relevance of that for us today in terms of looking at health and wellbeing. So some housekeeping to start off with. So for people who are joining us today via Zoom, we're expecting about 90 people online, so some quick tips for joining in today. You have been automatically put on mute and your camera turned off. We recommend watching today's session in active speaker view. See top right-hand corner of your screen if you'd like to change. And please ask your questions in the meeting chat. Please put a Q before any questions to help. The session will finish at 12:30, but we'll be leaving the meeting chat open until 1 p.m. If you have any further questions. If you're interested in linking up with some of the other participants in today's session, please complete the short survey we've sent out with your event reminder. For people in the room today, just a reminder around the COVID requirements and particularly physical distancing, the use of hand sanitizer, and if you're unwell, you shouldn't be here or at work. The bathrooms, if they're needed, are just straight out the door and up the hallway. In case of an emergency, they're also straight out the door, up the hallway and straight to the end. And if you wish to stand, please feel free and maybe just move to the edge of the room. When the online session finishes at 12:30, we'd like to invite you to stay and catch up over a snack. And this is going to be a chance whether you can ask further questions and to get to know each other and share any project ideas that you might have. For everyone here today, there'll be 3 opportunities during the presentation where we will have to answer questions. We will throw to people in the room first, and the question will be repeated so that our online audience can hear, and then we will answer. Questions from the online chat will be read out by my colleague Yvette and answered, and we will provide answers to any unanswered questions by email and on our website by the opening of the grants round. So what we're going to cover today, I'll give just a brief overview of Healthy Tasmania. Then my colleague Christy Measham will talk about the Healthy Tas Round 2, including some tips on developing your project idea and writing a good application. Now I'd like to play a video message from the Honourable Jeremy Rockliff, Deputy Premier and the Minister for Mental Health and Wellbeing, to officially launch Healthy Tasmania Round 2.
Hello and welcome to the Round 2 of the Healthy Tasmania Fund Grants Community Information Session. And thank you for coming along today to find out more about what you and your organisation could do to help people in your community live a better and healthier life. Healthy Tasmania is a government and community partnership to prevent chronic conditions and improve the health and wellbeing of all Tasmanians. Round 1 of the Healthy Tasmania Fund awarded over $2 million to 25 organisations, and Round 2 will provide $2 million for local government, community and not-for-profit organisations. This round will support projects that focus on community connections and address key areas including reducing smoking, improving healthy eating, being more physically active and improving mental health and wellbeing. The inclusion of mental health and wellbeing as a separate project category for the first time recognises the importance of supporting communities to promote good mental health and wellbeing, especially at this time as we address the impacts of COVID-19. We are already seeing the benefits of Healthy Tasmania projects right across our state, including practical support to quit smoking, growing and providing fresh produce to local communities, promoting opportunities to be active, creating connections between young people and older Tasmanians. Through Round 2 of the Healthy Tasmania Fund, we will see more communities develop local solutions to promote a healthy way of life. I'm excited and pleased to launch the Round 2 of the Healthy Tasmania Fund. Good luck with your applications, and I look forward to hearing about the positive changes in your local community. Thank you.
So just before we talk more about the grants, I'm just going to tell you a little bit more about Healthy Tasmania, further to what the Minister has mentioned. So Healthy Tasmania is the Tasmanian Government's 5-year preventive health strategy. It aims to make Tasmania the healthiest state by 2025. And we're now 4 years into this 5-year plan. So Healthy Tasmania has had 24 initiatives, some of which you might be aware of: the Healthy Kids Toolkit, the web portal, the student health initiatives have been some of the initiatives that have been running under the Healthy Tas strategy. Our grants are one of the key initiatives, and the Healthy Tas Fund is building on the success of our previous grants program, the Community Innovation Grants that you might be aware of. So there was 2 rounds of the Community Innovation Grants, and grants of up to $25,000 were available for community-driven innovative preventive health projects. The first round of the Community Innovation Grant recipients finished their projects in 2019, and most of the second round have completed their projects earlier this year. There's been some fantastic projects that have been run through the Community Innovation Grants, and there's a report on the first round that's available if you're wanting to get some ideas about what's happened to date and get any further ideas for your project going forward. The Healthy Tasmania Fund is administered by the Department of Health. It aims to support community organisations to improve their health and wellbeing of their communities. The first round opened in 2019, last year, and we received 104 eligible applications, 63 large ones and 41 small, requesting just over $11 million. From that, 25 projects were awarded funding and 11 large grants recipients and 14 small grant recipients. There is some feedback on the round 1 applications available if you'd like to go to our website to get more information. So I'm now going to hand over to my colleague Christy, who's going to talk with you more about the Healthy Tasmania Fund round 2. Thank you.
Thanks, Narelle, and thanks to those joining us online today and in the room. So there will be 3 sections to the information that I'll be providing today, and after each section, as Narelle's mentioned, there'll be an opportunity to ask questions, throwing to the room first and then to our participants online. So first of all, we're going to look at a bit about the guidelines, which we have in the room today, or they're available on our website. And so the second section, we will have a look at some information about what the review panel is looking for. So some important things to address within your project application. And finally, we'll have a section on some tips for applying, both when you're developing your project and your application, but also using our Smarty Grants portal to submit. So this year, the guidelines are slightly different to round 1, and we have allocated the funding pool a little differently. So you don't have to apply for the whole amount. So there is $2 million funding available, and it's divided up into our small grants, which are those up to $30,000, and the large grants, which are from $30,001 to $200,000. You don't have to apply for the full amount if you're applying for a small or a large grant, and you don't have to use the whole 2 years. So that's up to your project design and the needs of your community. The difference in the application process for small and large grants is essentially in the information that you have to provide within your application, and also the funding agreement requirements that you are required, including funding agreement reporting, which I'll go into in a little bit. The grants are GST exclusive, so they don't include GST, so don't include that in the amount that you're requesting. If your organisation is registered for GST, then you'll be paid the grant plus the GST amount. As the Minister's mentioned, the focus areas of the Healthy Tasmania Fund Round 2 are reducing smoking, improving healthy eating, being more physically active and improving mental health and wellbeing. Now, all projects should have a focus on community connections. So because Healthy Tasmania is a government and community partnership, we're really looking at community-led, community-driven projects. So community connections includes working in partnership with other organisations, getting people connected to community activities, increasing health literacy, and connecting those in communities to services and support. So in a minute, we're going to do a little bit of a poll. So think about what's your main priority that you're focusing on? And in the room, I'd like you to give a show of hands. And online, we've got the Zoom poll going. This is just to give us a bit of an idea of what people are interested. So in the room, is there anyone looking at reducing smoking? Improving healthy eating? Being more physically active? And improving mental health and wellbeing? Great. As the Minister mentioned, mental health and wellbeing is a new area for us this year, which is really exciting. And when we're considering what prevention and promotion means in mental health and wellbeing, I'd really encourage you to look at our website. We've got a list of useful resources across all the priority areas, including links to government strategies, frameworks, and also some data and best practice documents. So particularly when it comes to mental health and wellbeing, I'd encourage you to look at the Tasmanian Communications Charter on Mental Health and Suicide Prevention, which is published by the Mental Health Council of Tasmania. Also, the Prevention First framework, which is by Every Mind. And that gives you a really good breakdown around what is meant by mental health prevention and promotion. So we're not just talking about the prevention of mental ill health, but we're also including actions to reduce duration and severity of mental ill health. And when we're looking at promotion, it could include interventions that enhance social and emotional and spiritual wellbeing, as well as quality of life. So we really encourage you, whatever the priority area you're looking at, have a look at the useful resources on our website. Now, don't feel you have to include all of these areas. Think about what's your organisation's capacity, expertise, because all the applications will be applications will be assessed on merit. So if you've identified a focus area, think about how you can link that to your project activities, your outcomes, and how you're going to measure the success of your project. Ticking all the boxes doesn't necessarily mean that your project's more likely to be chosen. So the review panel will be looking at merit, but they'll also be looking at the mix of strategies both across the state and across the priority areas. So again, your project does not have to be a statewide project. Think about your capacities, expertise, your capacities, the capacity of your organisation to deliver. And certainly we had a mix in round one across the state between regional projects and statewide projects. We even had a social media project based online as well. So the first thing before you apply to consider is your eligibility. So your organisation must have an office, branch or presence in your and carry out your project within Tasmania. So you must also be an incorporated not-for-profit legal entity or sponsored by an incorporated not-for-profit legal entity. So within that we also include local government. Now, we do encourage partnerships. And so if your organisation falls into the following, not eligible to apply, while you can't submit an application yourself, you are encouraged to partner with an eligible organisation. So not eligible for the Healthy Tasmania Fund are individuals, for-profit organisations, businesses, schools, including school associations and universities, other state or Commonwealth government departments, but these partnerships are encouraged. For example, in round one, we had a council who were successful and they were working with local businesses that included sporting clubs and organisations to promote being physically active. We also had a youth health service who partnered with the University of Tasmania to increase the capacity of their organisation to address healthy eating and physical activity. So there's lots of different ways that you can partner and be creative to deliver. So funding is not available for a variety of things. So see page 3 to 4 of your guidelines for a full list. But key ones are if your project is aimed at producing a financial benefit, it's not eligible. We're not funding business as usual items, so services or items that you're already contracted to provide, or some of your fixed and ongoing operational costs, they are not covered by the Healthy Tasmania Fund. We're also not funding one-off events that don't provide a long-term benefit for the participants or the community. Also not included are purchase of real estate, motor vehicles, provision of scholarships, grants or loans, and also, of course, projects outside of Tasmania. So when you apply, you're going to be asked to provide some supporting documents. Now, if your organisation is being sponsored, it's not your organisation's documents, but the documents of your sponsor. So, and if you are currently funded in an ongoing way by the Department of Health, you are not required to attach these documents because we've already got them. So essentially, the supporting documents are all part of our due diligence process. So this is part of, the government's accountability for using public money. We need to make sure your organisations are above board, financially sound, and have the capacity to deliver the projects. So what we're asking for in the application form, and again, you'll see it's quite different for small and large grants. So this is something to consider when you're deciding, do you go for $29,000 or $31,000? So for small grants, we require a certificate of incorporation. For large grants, the documents we require are much more. So that's the certificate of incorporation. We also require certificates of currency for professional indemnity, and that's up to $10 million per claim, and public liability up to $20 million per claim. Now, we understand that many small organisations might not have this level of insurance. So as part of your application, if you don't have that level of insurance, we're asking you to commit to purchasing it if you're successful. Now, that increase in any insurance costs can be a budget item for your project, because we don't want that to be a barrier for small organisations to apply. We're also asking for large grant applications to include annual reports and audited financial statements for the last 2 years. Now, if you submit early on in the process, like if you're lined up September 8th and ready to hit go, we understand that not all organisations may have these available for the 2019 to 2020 financial year. So there is the option of attaching the 2017 to 2018 documents instead. However, we would prefer the most recent financial year's documents. Now, to provide you with a little bit of the key dates for the application process, the application's open on the 7th of September 2020 with 8 weeks and it's open for 8 weeks, so closing on the 30th of October 2020. Now, the review panel and due diligence process will take place between November and January. And the review panel is made up of representatives from the Department of Health, including Public Health Services, the Mental Health and Alcohol and Other Drug Directorate, Department of Education, Department of Communities Tasmania, and Primary Health Tasmania. Now, the review panel will provide recommendations to the Minister, and the Minister for Mental Health and Wellbeing will have the final determination. So we plan to notify all applicants by March, and applicants will have 4 weeks to sign their funding agreement and return to the Department of Health. Projects will need to be finished by June 30th, 2023. So it will end up being a little bit over 2 years, just due to the funding agreement timelines. If you are successful, you will be signing a funding agreement with the Tasmanian Government, and that comes with certain responsibilities. So all projects who are successful will be required to acknowledge Healthy Tasmania as the source of their funding. We also have certain reporting requirements. So one of those is a networking forum. Now, this is something that we started with our community innovation grants rounds, and it was a chance for organisations to get together, share their projects, share their challenges and achievements. And our feedback on that was that it was very valuable to organisations. So we have the intention of continuing that with our round 1. Due to COVID, it's looking a little different this year, and instead we will be asking our organisations to engage in our online learning, listening and learning series. Stay tuned, we're going to put out more information about that shortly. And for round 2 applicants, we will consider that at the time. So we'll have a look at that leading up to the end of next year and see what the situation's like. So all organisations will be required to submit progress reports every 6 months of their project. Now, we do this reporting across our Smarty Grants platform, so it's an electronic form submission every 6 months with standard questions that link to your project outcomes and KPIs. You will also be required to complete a final project on completion of your a final report on completion of your project. In addition, the large grants will meet face-to-face or on Teams with staff from Healthy Tasmania or Public Health Services. And large grants are also required to have quality and safety reporting and annual grant financial accountability reports. So that's another thing to keep in mind when deciding, large or small grants, that additional reporting requirements for a large funding agreement. Okay, so we're going to pause here for our first round of questions. So if you're in the room, I'll ask you to share the question. I will be repeating it for the benefit of our online audience. And after we've addressed the questions in the room, we'll throw to Yvette with the online questions. Yes.
Can an organisation submit more than one application?
Okay, so the question from the room was, can an organisation submit more than one application for multiple projects? And the answer is yes. So it doesn't necessarily increase your chance of being successful. Just think about, all applications will be assessed on merit. But certainly if you have 2 projects that fit the focus areas, both have a focus on community connections, and you wish to submit for both of them, then you're more than welcome to do that. Yes.
Did you say local government are ineligible to apply?
The question is, are local government ineligible to apply? No, local government can apply. So they are eligible to submit a project application. So we had quite a number of local governments who were successful in round 1. Thank you. And another one, yep.
I suppose on the website, have you got specific requirements around evaluation?
Yes. So the question was specific requirements around evaluation. We'll be doing that in the next section. So, yeah, thanks. All right, I might throw to Yvette and see if you have any questions for the online audience.
Yes, we have some questions on the online audience. The first question we have is, where can we access the report from the community fund projects?
So we have our report available on our website head to the Healthy Tasmania portal. We have stories from many of our successful grant recipients, and I believe we'll also have our annual report available shortly, which captures a lot of the actions that have been happening across the Healthy Tasmania strategy.
And we've got another question from Julie in Launceston from Circle Dancing, and her question is, we have been self-sustaining for several years but are in financial difficulties due to fixed costs during COVID. Is assistance available for public liability insurance and music royalties?
Look, as the guidelines have specified, Healthy Tasmania does not fund ongoing costs. If you're looking at COVID recovery, I'd encourage you to investigate whether the Tasmanian Community Fund could be another avenue of funding. Certainly what we're looking at are either new initiatives or projects, or if you are currently conducting a project where funding may have finished or due to finish, we would like to see what you have learned from that existing project and what is needed and how you're going to implement those learnings.
We've got another question. They're active here online, which is great. Is there a framework for quality and safety reporting if successful?
Yes, certainly our funding agreement management team would provide the organisation with that framework.
We have another question. Is funding split equally between the 4 key outcomes of the grants? For example, 500K for reducing smoking, 500K for improving mental health, etc.
Look, the review panel will review all the applications on their merit. So there hasn't been a firm breakdown. Certainly Narelle provided you with the numbers around, it was 11 large grants and 14 small grants, and they were across a range of the priority areas. I do have those numbers to give you an indication of that. So in round 1, we had 2 that were addressing reducing smoking, 7 that were addressing healthy eating, 6 physical activity, and 11 that were across more than one priority area. So it will depend on the mix of strategies and regions, and that's part of the review panel's assessment process.
We have another question. Who is audited with, I think this is 70K plus grants, the sponsor or the suppliers?
So I believe that would be the sponsor. So essentially, if you're sponsoring an organisation, that means you take financial accountability to deliver the project, and so that would be the sponsor organisation.
Okay, we have another question. Does each successful project provide a report that includes how they evaluated their project? Are they available?
So what we'll do, I'll talk about evaluation in the next section. Certainly the reports that organisations provide to us are for the requirements of their funding agreement, and they don't become public documents. But what we are doing through Healthy Tasmania is providing stories of change within the community. So I really encourage you to keep an eye on the Healthy Tasmania website and Facebook page, because we're quite often sharing some of those outcomes and positive stories about what changes happening in communities.
Next question is, will the grants include scope to cover a wages project management component?
Okay, so certainly within the guidelines, you are able to include staffing costs where your organisation currently does not have capacity to deliver the project without it. Now, there's a couple of ways you could do that staffing. So certainly some of our organisations have created a position, a project officer position, and included those staffing costs within their budget. Others have said, no, we are actually going to subcontract that to another organisation. And that's possible as well. Subcontracting will require written permission from Healthy Tasmania to do that. But those two can both be budget items within your project.
If Healthy Tas is currently funding a project, can we apply for funding to extend and enhance the same project based on the eligibility criteria?
So certainly if you have been funded previously, you can reapply for funding, but we would want to know what you've learned and how you're going to implement that beyond the scope of your first round project.
You mentioned the project demonstrating a wide reach. What is defined by wide reach? Is this geographical or population based?
I might save that until our next section where we're actually going to address some of those criteria.
Here's a question comment. Hello, such a wonderful initiative. Last year we received organisational feedback surrounding creating stronger community relationships. Mm-hmm. Do you have an option to facilitate those relationships with like-minded organisations? I know you mentioned the survey briefly earlier.
Certainly. So we are providing people with the option of sharing your details today, both in the room and online, to help facilitate some of those organisations. Also, if you are talking to Healthy Tasmania, or we're kindly getting some support from Health Promotion South to provide some advice, if you are talking to us and want to be put in contact with some other organisations who might be investigating similar projects, then we can help facilitate that as well.
One last one, I think.
One last one.
We are currently funded by a Department of Health grant. Can we apply for a Healthy Tas grant to progress activity inside that grant?
So certainly if it's something that funding does not cover, then and it's additional to what you're funded through the Department of Health, you could include that as a Healthy Tas application. But within your application, be really clear about why additional funding is required. Because if the review panel read your application and think, no, you're already funded for that, then you will be a lot lower ranked. All right, we're going to move into the second section, which sounds like it's going to be really relevant to people online and in the room, because we're going to get some insights about what the review panel are looking for. So to kick this off, we have a short video from some members of the review panel to help give you some insights into what they're looking for during the review process.
Hello, my name's Julie Williams. I'm the Manager of Chronic Conditions Prevention in Public Health Services in the Department of Health. And I'm the Chair of this year's Healthy Tasmania Funding Review Panel. The purpose of this video is to inspire and encourage you to put in an application to the Healthy Tasmania funding. We want to be able to share with you some ideas that other communities have been able to use with this funding, and also to share tips with you about what a good application looks like.
Hello, my name is Kate Garvey, and I'm the Manager of Partnership Development within Public Health Services. My role is as a panel member, and I've done that role now. This will be the 4th time, so I've really had the pleasure of seeing a lot of great applications.
But before we start, I'd like to acknowledge the Tasmanian Aboriginal people as the first people of Lutruwita, Tasmania. For over 2,000 generations, Tasmanian Aboriginal people's health and wellbeing has been and continues to be based on a deep and continuous connection to family, community, land, sea and waterways.
Healthy Tasmania is really set up as a government-community partnership. There's a lot of health and wellbeing issues in the community that really the community knows most about. So when we're talking about health and wellbeing, we're focusing on some of the things that affect health and wellbeing. These include smoking. We have a focus on promoting physical activity, healthy eating, and also a really important one is mental health and wellbeing. We also have a focus across all of our programs on community connection because we know that there can be no community health and wellbeing without a sense of community. There's really a diversity of programs that we will fund. In the past, when we've talked about communities, we've talked about geographic areas that might make up a community, but we've also talked about groups of people such as the Tasmanian Aboriginal community or the LGBTI community, as they might be a focus area of the work. Some of the projects we've funded have been around social media projects, capacity building of staff, or particular programs that might meet a priority population.
There are some things that we'll be looking for. We really want to see what you are planning to do that will make a difference in your community. How will you build on your community knowledge and connections to improve the health and wellbeing of the people living in your community? So some of the things that we are looking for in that is whether your organisation has that capacity to deliver on the project outcomes, whether you have strong partnerships in place and that you're willing to work with others to get the job done. We'll be looking to see whether you're tapping into the evidence base about what works. We want to see how you'll reach those people in your community who might most benefit from your project. And finally, we'll be looking to see whether some of the outcomes expected from your project will have longer lasting benefits in your community.
Collaborations mean that we can really get to the heart of what is the best project. You know, what is the community need? It allows us to engage with community in all different ways, in all different aspects of the community, and it allows us to build a really well-fitted program or project. When we say sustainability, what we mean is, what are the benefits that exist for the community beyond the funding cycle? We're not expecting that program to run and to continue without funds, but what we're thinking is, what are the valuable things that have been gained? For example, relationships. Sometimes people have been working alongside each other and haven't known about each other's existence. So even just coming together and realising that they've got common goals in the community can really help the future of how they work together. I think it's also insights and knowledge that a community gains from programs that they can take into other things. Sometimes people see that they've got an existing role that can take on other functions. So all of those are ways to consider sustainability.
In the application process, you'll notice we talk about reach and access. What we mean by that is looking at those people in your community who might be missing out, those people who might be at risk of poorer health outcomes. Having a think about how you might reach those people is really important. How you might involve them in your project in a way that gives them some sense of control and ownership over that. And the best way to do that is to think about what matters to those people the most and how can you incorporate that into your project. We know that COVID has had a big impact on the way that communities have connected with each other and with the people who are living within that community. And we've seen some amazing examples of how communities have had to adapt in the COVID environment. So when you write your plan, when you write your application, think about the backup plan, what you might need to do differently if the need arises. And know that we'll be flexible and work with you along the way. So the next step is to visit the website that you can see on your screen. There you'll find the guidelines, frequently asked questions, and links to other useful resources like data and research that might help you with your application. So thank you for listening. I hope you found the information useful and I wish you all the best with your application.
I really encourage you to apply for these grants. There are a whole wide range of things needed in the community, and really we fund a wide range of things. So I really look forward to reading your applications. Thank you.
Okay, so some great insights there, and I'm going to go into a little bit more detail about the 7 criteria that are in your guidelines on page 5. So there are some hint questions both within the guidelines and the application forms to get you thinking about the types of things that the review panel is looking for. So within the application form, there is a specific section to address the criteria. So namely the first 5 that are listed today. So rationale, reach, access, collaboration and support, and sustainability. So here you will have from about 150 to 250 words to describe how your project meets these criteria. So this is, your place to sell your project and how it links with the Healthy Tasmania priorities. So to be successful in receiving a grant, you'll need to respond strongly across all criteria. So when you're writing your application form, make sure that you're addressing these as a priority. So for rationale, we want to see that you're drawing on a strong evidence base. So not only in the literature, across government frameworks and guidelines, but also evidence from your community. So if you've done a community survey, for example, you may reference that in that criteria. There's also a section in the application form for you to attach relevant documents. Or you might decide to link to a website or a YouTube clip that demonstrates some of the evidence from your project proposal. When we talk about reach, as Kate and Julie indicated, we're not just, maybe your project will have wide community reach or engagement, but perhaps you might be reaching a smaller group of people, but you are working with a high needs population group. So people who are vulnerable to ill health. So that could be in a geographic location, so maybe you're working with a rural and remote community, or it could be with a group of people who are at risk of ill health. So think about, are you aiming community-wide? How are you working with high needs communities? When we're talking about access, we want you to think about those people who do experience those health inequities and how you're going to involve them and engage them, not just wait for them to be involved, but what are your strategies for making sure the people who need your project the most will be able to participate or be involved. As we've talked about, collaboration and support is really at the heart of Healthy Tasmania, and we would like to see evidence of that. So it could be partnerships with a wide range of community partners. It could be with community organisations or peak bodies. It could be with local businesses. Now, we'd like to see evidence of that, and there's opportunity for you to attach letters of support from your partner organisations, or you can attach items that might show a history of working together, a history of achieving health outcomes together. Now, sustainability is one that often people get a little bit puzzled about with short-term funding, and as mentioned in the video, really the focus is on the sustainability of outcomes. And, think about this too. If your project's been run before, think about, well, why is that funding needing to continue? And how will you make the outcomes sustainable again? Now, outcomes and evaluation, there's a specific section of the application forms that deals with that, and I'm about to go into more detail. And for value for money, we will have a budget section for you to put your budget, which is more detailed for the large grants. We also have included for the first time this year an opportunity to show or demonstrate any in-kind support that your organisation is providing or your partner organisations are providing. Now, this is not compulsory. You do not need to provide in-kind support to be eligible for a Healthy Tasmania grant. However, we included it as feedback from round one because a lot of organisations were providing it and really wanted to show that to demonstrate their project's value for money. Now, also in value for money, if your organisation is already funded by the Tasmanian Government, think about how your project complements but goes beyond what you're already funded for. Because again, as per the guidelines, we won't fund things that you're already funded to do. Think about how your project complements and expands on that. So to demonstrate your outcomes, within the application form there's a whole section devoted to this. So you'll be asked to describe your outcomes, and this is what the review panel will use to assess your application against these criteria. So outcomes mean the changes or the results that you expect to achieve when your project has finished. If your project is successful, these then become the outcomes that are purchased through your funding agreement. Now, we're asking that you provide between 2 and 5 outcomes. So it might be that healthy eating is improved in your community. Think about what are those changes. You'll also need to show how you're actually going to measure what's happened. And to do this, we are using results-based accountability. So if you've not used this before, it's actually a really useful way of evaluating not just how much you've done. We're not just interested in how many people have gone through your program, but we want to know how well did you deliver your project, and is anyone better off? So we will ask you to provide 1 to 3 measures for each of these questions. And these will become the key performance indicators of your funding agreement. So if you'd like more information, see the guidelines, and I'd encourage you to have a look at results-based accountability as you're developing your project measures. So we've got our next opportunity for questions. I'm going to throw to the room first for any questions around the review panel and the assessment criteria and outcomes and evaluation. Okay, Yvette, do we have any questions online?
We don't as yet have any questions.
Oh, that's all right. We've got one in the room. Thank you.
So with the results-based accountability, do you have an adaptive management, do you have an allowance for adaptation that happens throughout the life of the project as a result of the activity?
Certainly. So what we can do is, if you're identifying the KPIs, the outcomes, and if for some reason during the project they change, we are flexible and able to renegotiate. For example, many of the projects that were started this year, COVID happened and many of them had to rethink their activities. Many of our organisations are actually finding that their measures are still valid because the measures are attached to the outcomes, really. So they're measuring, okay, what is the change in our community? So even though their activity may have moved online rather than face-to-face, they've still been able to keep that KPI. But certainly we do know that this is a learning process. So if for some reason those outcomes we'll keep the outcomes the same because that's what the government's purchasing, but if the measures need to change or the activities need to be adapted slightly, then we can negotiate that.
So with most significant change technique, which is what we generally use, we often get outcomes that weren't articulated in the initial plan, but they're definitely worth measuring and capturing. Do you have an allowance for that?
Definitely. So within our reporting process, we really encourage, if there are unexpected benefits, that's included. Yeah. Thanks. How are we going with the online?
Do you have a question online? If we are to address the key feedback areas from previous year, do you think that leaves us likely to be successful?
So certainly, as part of round one, if you had submitted an application, we did provide all applicants with some general feedback, and then upon request, we gave some more specific individual feedback. Now, we cannot guarantee, but certainly if you improve upon those areas, I would suggest that it may increase your chance of being ranked higher. However, the standard of applications that we saw last year was extremely high, and given the engagement that we've already had in the grants process, I envisage that will be the same. Any other? Okay. So the final section is around tips for developing your project and putting the application together. So start at the guidelines, make sure your organisation's eligible, and also go to our useful resources as well. So make sure that your project is in line with those national guidelines, and also access some of the data that's available around health data to help you identify, what needs to change in your community. Really encourage you to speak with your community if you're not already. We really want to see that strong connection between your project, what the community wants and what the community needs. So it's helpful to get their input on what's their priority at this time and what needs to change to ensure that their health outcomes are improved. Think about what activities and strategies that you will use to increase the community's knowledge and capacity. And also make sure you're thinking about how will you know that you're successful, and you can build that into your outcomes and your KPIs. We really encourage you to look at what is already happening across your community. This will avoid duplication, several organisations submitting a really similar project application, but it's also a great opportunity to identify any potential partners. It's also good to think about your organisation's capacity to deliver. So it might seem really great to apply for the full amount, $200,000, but can your organisation deliver this? And can you deliver it within the 2-year time frame? So part of this might be developing a basic project plan before you even launch into the application form, thinking about what is your project, what are you aiming to achieve, your timelines, how you're going to do it, what's the budget needed. Now, as we mentioned, COVID has been a big influence on our round one projects. So we really want you in your application process to consider the potential impacts going forward. So from our round one, it was about 14 of our 25 projects had to postpone or suspend activities for at least a period of time due to the impacts of COVID. And there were 3 main reasons for this. One was that many had face-to-face activities or workshops that were often focusing on vulnerable groups of people. So for health and safety reasons, they had to be shut down. And sometimes these activities were able to be moved online, but that wasn't always the most appropriate solution for some groups. We also had projects that were put on hold because partners were not operating, so sporting clubs or PCYCs, neighbourhood houses. Then we also had organisations that were pivoting their service because the needs of their community had changed. For example, food security became a really important issue for many communities. So going forward, we're asking you within your application forms, whether it's a small or large project, to show us that you've considered this. So we are asking the question, how have you considered the impact of COVID-19 on your project? So how can your plan be implemented or adapted if restrictions levels change? And how are you going to manage the risk? Risk of persons contracting or spreading COVID-19, and how are you going to ensure physical distancing, etc. So that could be that, you are identifying potential for moving online or the potential for spending time planning or capacity building. There are a number of ways that our current organisations have adapted. So when you're writing your application, really encourage you to think about what information you need to provide and not leaving it to the last minute. And I really encourage you to think about selling your project idea to the review panel in a way that it is easiest for them to understand. Last time we had over 104 applications. So to make yours stand out, be really clear. Don't presume that the review panel knows your organisation, your capacity, your strengths or what you do. Make it as easy as possible for them. So we really encourage you to write in clear, concise, plain English. Some people get tempted when it's government to make it wordy or sound official. It's not the most complicated or most difficult language that communicates what's going on in your community. We really want to understand the nuts and bolts of what you're going to do, why you're going to do it, how you're going to do it. If you're not familiar with it already, I really encourage you to have a look at the 2610 guide around plain English. Get some really good tips for writing, for communicating clearly. Keep it short. Dot points are okay. Formatting in Smarty Grants can be a little bit, you can't actually format, so think about how you're going to use hyphens or line spacing or capital letters to, communicate some of those things that you might usually use formatting for. And this is the same for across your application, whether it's your organisation's capacity, your criteria or your KPIs and outcomes. Make sure it's easily understood by someone who's not familiar with the project or your organisation. So addressing all your criteria and using evidence to back it up is really great. It's really important in your application. Proofread. That's part of communicating clearly, and it can help to get someone to read it for you, someone either outside your organisation. And within Department of Health, so if you want support for your application, Healthy Tasmania can provide support on the interpretation of the guidelines and whether your organisation's eligible. If you want feedback on the quality of your application and your project, we've kindly had some support from Health Promotion South, and Rebecca Essex is in the room today with us, and details are in our frequently asked questions. So thank you, Rebecca, for volunteering to provide some of that support and feedback. Now, get in early, not on the last day, otherwise Rebecca may not have the opportunity to assist you. So moving on, I'm just going to give you some tips around the Smarty Grants platform. So many of you may have used this previously to apply for grants, or if not, if you're new to it, be reassured it's user-friendly, and based on feedback from last round, we have improved our application form as well. So you will need to log in or register to Smarty Grants to apply for the Healthy Tasmania Fund. So the link is available in our guidelines and on our website. And if you have Smarty Grant access or a login, but you can't remember your password, there's an opportunity to reset that. So if you have any login issues, Smarty Grants are helpful, and contact them directly. With our applications, there are 2 separate application forms, so make sure that you're filling in the correct one for the amount that you want to apply for. You will notice when you log into the form that you can't get past any questions unless you confirm your eligibility. We don't want you wasting your time filling in the form to just find out, actually, my organisation's not eligible. So you can preview the whole form, so that's currently available now. So if you haven't already, get on our website. You can download a PDF, and that can help you start preparing before applications open on the 7th of September. So when you submit your application, you will receive an email confirmation from Smarty Grants that your application has been received. If you don't, feel free to get in contact with Healthy Tasmania, and we can confirm that for you. So applications close at 5 p.m. on the 30th of October. We will not accept late or incomplete applications. So make sure that you have time to thoroughly review your application, whether that's double checking you've got the correct documents, make sure the person with the password doesn't take the day off before you're due to submit. But if that does happen, you can get in contact with us and we can reset it for you. So when you're completing the application form, make sure you've read through all the questions because that'll give you an idea of what information needs to go where. It can be helpful to start preparing your application points in a Word document. Just be mindful of there are differences in the word count between Smarty Grants and Word. So some people found that the algorithm is a little bit different. So just be mindful, you might need to shorten it a little bit perhaps. So as I mentioned, there is no formatting in the form. So use those techniques like capital letters, dashes to make things stand out. There are lots of compulsory fields within the application form, so marked by an asterisk. So you won't be able to submit an application unless you've addressed all of those questions. So that includes the outcomes, KPIs and criteria, as well as all the information that we need for due diligence. And we've had our first technical malfunction. I've accidentally pressed something. 2610 guide for those out of the room. That's it. Where am I? Okay. Is anyone an expert here? Exit full screen.
That's the close one. And then at the top.
Oh, I've closed the wrong one now, of course. Oh, well, if that's all that goes wrong today, we've done well. Okay, the joys of live streaming. and active links. So certainly we've got, as I mentioned before, lots of useful resources. Have a read. Find the up-to-date data on your priority area. Think about what's happening in your community and how that relates to what you're doing. So we have links across different areas. We have the strategic plan. We have the Healthy Tasmania web portal, which has lots of different stories across our grant rounds that can help inspire you and think about what's relevant to your community. We also have links to smoking, healthy eating and physical activity, and mental health and wellbeing resources that will help you thinking about the rationale and the evidence behind your project, but also the types of strategies that might be useful to the people that you work with. So for more information, please head to health.tas.gov.au/Healthy Tasmania Fund, and also have a look at the Smarty Grants platform. Really encourage you to read through the application forms, have a think about whether you want to apply for a small grant or a large grant. Also, keep track of our Healthy Tasmania Facebook page, where we share examples of stories that are happening in our communities and also some of the evidence around what's happening. So we are also going to be putting up the resources from our information session, so including the videos that you've seen today and the presentation, and hopefully linking to a video of today's live stream. If during your application process you decide that actually you're not eligible for Healthy Tasmania Fund, or it's not the best source of funding for your project idea, really encourage you to look at the Department of Communities Tasmania, Department of State Growth, the Australian Government, and also, as mentioned before, the Tasmanian Community Fund, which is specifically focusing on COVID recovery. So that brings us to the end of our information for today. One last opportunity to ask questions. And as mentioned earlier, the online chat will stay open until 1 p.m. And also in the room we'll have the opportunity to network and share our details after. So anyone in the room have any further questions?
I do. It's one about the overlapping of grant applications. And for example, if there were a component that it might have been a small grant round or something like that, and you might ask for a component of a project. And if you don't know about that, and then you apply for this Healthy Tasmania grant, and it just happens that's part of that as well, because we don't often know the outcome of those grants for a while. Is there capacity to renegotiate an adjustment to the application if that were necessary?
So what we've asked is that your Healthy Tasmania Fund grant application is not dependent on any funding. Yeah. So if you'd submitted to another fund and were successful, then you may need to withdraw your application. Or if you're planning to apply for two different funds, think about how they're different. What element of the project might you apply for Healthy Tas, and what from any other funding source? So sorry, I forgot to repeat the question. That was around what if your project you're looking at a couple of different sources of funding, and what happens if there's overlap? Yes.
Similar question other way round. If you've got this one source of funding that you would like to apply, say you went for the 200,000, but you had two streams that you wanted to fund. So, for example, we work in a place-based way, but we also do outreach. So they're discrete projects, but they have crossovers. It's actually part of the sustainability plan that there's a crossover because you refer people back to the place-based. So at the end of the term of the program with the outreach. So I guess what I'm saying is if they're kind of two discrete projects, but would you apply separately for two projects, or would you apply 200,000 and have two arms to the activities that you're applying for?
Okay, so that for the online audience, that was a question around if you've got a project that has two streams that interact with each other, are you better off applying for two separate grants or including them within the one grant? Do you have any suggestions, Narelle?
I think if they're reliant on each other, then it would be better to apply for them together, because obviously you wouldn't want to apply for them separately and then only receive one of them. So I'd suggest if they rely on each other in a significant way, then it would be better to put them together and show the two components of those. If they connect, but they're not actually reliant on the other one to actually, if you didn't get it, then it would be okay to actually do them as two separate ones. Does that answer the question?
Yeah, I'm just wondering how much complexity you can have in your. So we're asking for funding for our project, but a project could have a lot of components and be quite complex. So I take on board what you've just said, and I'm also wondering if maybe you could talk about. Maybe I'll just go on the website and look at previous successful ones. But will the future look like the past? I mean, obviously you're emerging, so maybe it might be a new idea, but it still could be a good idea. So.
Oh, and look, I'm just thinking in terms of some of our current fundings about looking at new ways of working and things. So there have been organisations where, as you say, it's a project, but it's complex. So organisations where they might be delivering, I can think of one where the focus, one of the focus areas is around improving healthy eating. And so they are providing their community with healthy meals, but a major part of the project has actually been in development of partnerships and capacity building so that provision of healthy meals is sustainable. So potentially when they were scoping, they might have gone, are we just providing healthy meals? That could have been a project that could have been successful in its own right, but we're actually linking up with other organisations to develop those relationships to make sure that was sustainable. So the project ended up being quite complex rather than simple provision of healthy meals.
If we come up with a draft of something, is there a project officer that we can apply?
Yes. So to see whether it fits within the eligibility and the guidelines, certainly you would contact a Healthy Tasmania. And if it's around, kind of looking at that project design and getting feedback around that, Health Promotion South with Rebecca Essex and her contact details, you can get them today, or they're in the frequently asked questions. Thanks, Jane. Anyone else in the room before I move to the online participants? All right, Yvette, do we have any questions from the Zoom?
Yes, we do. Okay. Is there a way I can reach out to others at this forum to see who else is thinking about a particular program topic?
Certainly. So we are going to be asking people if they're interested in sharing their details, their project idea and their priority areas. This is a great way to start making some of those networks. But two, I encourage you to get in contact with Healthy Tasmania because certainly we can approach some of our existing partners to see if they would be open to you contacting them.
I have a question here. Provision of clinical treatment services is outside of scope. Could you please give some more guidance about how clinical is defined here? Thank you.
Okay, so we're thinking in terms of a standalone. So if it was a standalone pop-up clinic, then that would be outside of scope. Some of our organisations have used screening, so, blood pressure checks, etc., as part of their project design in terms of measuring health outcomes and helping people improve their healthy eating or improve their levels of physical activity. But if it was just delivery of, right, we're going to deliver, a doctor's clinic to a certain target audience, that's probably Healthy Tasmania would not be the best source of funding because we are prevention focused, we are health promotion focused, and I know in good clinical services that's part of the whole package, but certainly we're looking at those projects where it's not standalone.
Okay, the next question is, how many extra support documents as evidence can we submit with the application?
That's a good question. I don't know off the top of my head how many supporting documents, but certainly what you can do is you can click through to our Smarty Grants website, have a look at the application form, and it will be in there. It'll be able to tell you the maximum amount of files. When uploading files, we really encourage you to keep the size to 5 megabytes or under. The system does cope with up to 25, but it's going to be less easy or a longer delay in loading. So if you can keep it under 5 megs, then that's best.
Okay, and we've actually got a comment, and Michelle Tower up in the Health Promotion North is actually supporting some of the answers to this, which is fantastic. And it's and regarding the attached documents, it's up to 5 documents.
Right.
And the comment we have here is East Coast Tas region not mentioned in the application form as a region section. And Michelle has answered with East Coast will be north, but I don't know if you want to add anything to that.
Yes, and we do have a section where you can identify your target suburbs as well, or target region. So if you don't feel that fully captures where you'll be working and the community you'll be working with, there are opportunities within the form to clarify that.
I think that's all we have at this stage.
Okay, thanks, Yvette. So the chat will remain open. What we are going to do from all of our sessions, so we've run 2 previous sessions this week, we will be compiling all those frequently asked questions and adding them to the information on our website. So we'd love to thank you all for attending today, whether it's online. Thank you, online audience, for joining us. It's been a bit of an experiment for us as well. So we're really glad it's helped us reach some of the regions that we would not normally get to with our information sessions. So thanks for joining us today. And please remember, don't hesitate to get in contact to clarify the guidelines. If you have any issues accessing the application forms or working through it, and don't forget, get in early with that valuable support from Health Promotion South as well. So thanks for joining us today. Stay on in the chat if you're online. We will address those questions as soon as we can, and certainly if you're in the room, please stay on for a snack to join us and ask any additional questions that you have. So thank you all, and good luck.